I'm your host, BrightLearn, and today we're embarking on a journey that will challenge everything you thought you knew about your body, your brain, and the nutrients that keep them running. So, grab a cup of coffee, sit back, and get ready to have your mind blown. Our story begins with a book that has been quietly making waves in the world of nutritional medicine, A Nutritionist's Guide to the Clinical Use of Vitamin B1 by Dr. Derrick Lonsdale. This book, originally published in 1987, was nearly lost to history in a warehouse fire, but its insights are more relevant today than ever before. Lonsdale proposes a radical shift in our understanding of disease, suggesting that many of the ailments we face are not due to infections or genetic defects, but rather to a fundamental inefficiency in how our cells use energy. At the heart of this energy crisis is thiamine, or vitamin B1, a crucial nutrient that acts as a catalyst in the citric acid cycle, the body's energy powerhouse. Lonsdale argues that without sufficient thiamine, our cells struggle to produce the energy they need, leading to a cascade of symptoms that can mimic everything from anxiety and depression to heart disease and even sudden infant death syndrome, SIDS. Now, you might be thinking, wait, isn't thiamine just for preventing beriberi? Well, yes, but that's just the tip of the iceberg. Beriberi, a classic thiamine deficiency disease, is characterized by cardiovascular and nervous system issues, particularly in the autonomic nervous system. But here's the kicker. Lonsdale believes that thiamine deficiency is far more common than we realize, even in affluent societies, and that it manifests in ways we often attribute to other causes. Let's talk about the autonomic nervous system for a moment. This is the part of our nervous system that controls all the things we don't consciously think about, like heart rate, digestion, and breathing. It's like the body's autopilot. Now, imagine if this autopilot started malfunctioning. You might experience symptoms like dizziness, fatigue, digestive issues, and even emotional disturbances. Lonsdale argues that many of these symptoms are due to thiamine deficiency affecting the autonomic nervous system. But how does this happen? Well, thiamine is essential for the proper functioning of the hypothalamus, the brain's control center for the autonomic nervous system. When thiamine levels are low, the hypothalamus struggles to maintain balance, leading to a state of chronic stress or fight or flight response. This can manifest as anxiety, irritability, and even panic attacks. But it doesn't stop there. The lack of thiamine can also affect the body's ability to handle stress, leading to a vicious cycle of energy depletion and further symptoms. Now, let's take a closer look at some of the case studies presented in Lonsdale's book. One particularly intriguing case involves a child with intermittent cerebellar ataxia, a condition characterized by episodes of loss of balance and coordination. Lonsdale discovered that this child had a defect in pyruvic dehydrogenase, an enzyme that relies on thiamine for its function. By supplementing the child's diet with high doses of thiamine, the episodes of ataxia became less frequent and less severe, highlighting the critical role of thiamine in energy metabolism. Another fascinating case is that of a young woman with symptoms resembling familial dysautonomia, a genetic disorder affecting the autonomic nervous system. Despite having no family history of the disorder, she exhibited many of its classic symptoms, including postural hypotension, excessive sweating, and emotional lability. Lonsdale found that her symptoms improved significantly with thiamine supplementation, suggesting that her condition might have been due to a thiamine-dependent metabolic disorder rather than a genetic defect. But perhaps the most startling connection is the one between thiamine deficiency and sudden infant death syndrome, SIDS. Lonsdale presents evidence suggesting that some cases of SIDS might be due to a defect in thiamine metabolism, particularly in the brain. He argues that thiamine deficiency could lead to a state of chronic hypoxia, or lack of oxygen in the brain, which could be fatal for infants. Now, you might be wondering, how can I tell if I'm thiamine deficient? Well, the symptoms can be subtle and varied, ranging from fatigue and irritability to more serious issues like heart palpitations and neurological disturbances. Lonsdale emphasizes the importance of considering thiamine deficiency in the differential diagnosis of many common conditions, particularly those involving the autonomic nervous system. So, what can we do to ensure we're getting enough thiamine? First, it's important to maintain a balanced diet rich in whole grains, legumes, and lean meats, all of which are good sources of thiamine. However, for those with absorption issues or increased needs, supplementation might be necessary. Lonsdale advocates for the use of thiamine derivatives like thiamine tetrahydrofuryl disulfide, TTFD, which are more easily absorbed and utilized by the body. In conclusion, Lonsdale's work challenges us to rethink our approach to health and disease. By focusing on the fundamental role of thiamine in energy metabolism, we can begin to address the root causes of many common ailments rather than just treating the symptoms. As we continue to explore the intricate connections between nutrition, metabolism, and the nervous system, we may unlock new ways to prevent and treat diseases that have long puzzled the medical community. Thank you for joining me on this journey. I hope this episode has inspired you to think differently about your health and the role of nutrition in maintaining it. If you enjoyed this episode, be sure to subscribe and leave a review. And as always, stay curious, stay healthy, and keep learning.
This has been a BrightLearn video from BrightLearn.ai on the book A Nutritionist's Guide to the Clinical Use of Vitamin B1 by Dr. Derrick Lonsdale. Visit BrightLearn.ai for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.